Let me just narrate you this story, a very interesting one, and professional hazard, I should say. And this couple came to me. We were trying for pregnancy for about 6 years, and when I was evaluating them, there was a marginal low sperm count. The sperm count was about 14 million, volume was about 1.2 million, motility was about 20%. So all the parameters are a little low. And husband was a pretty young, thin boy, and I asked him, "What's your profession?" And he says, "He's a marketing in charge of a company." I said, "Well, good." But then said, "Since your counts and everything is a little low, I need to evaluate you further because I need to classify which class of Aphrodite classification you fall into." So I did a clinical examination. His testis was pretty normal size. He did not have a varicocele or any other abnormality in the scrotum. And I said, "Okay, well, please get your FSH, LH and testosterone done." To my surprise, even his testosterone was low, his FSH was low. I said, I was not expecting this. That a youngster like you, that you're having this, can you just tell me what's your profession and what exactly you do? And he said, by the time the wife had hinted me that you have to tell him to stop alcohol, and I wanted to know more about it. And when you ask a blunt question, how many times you drink in a week, they will always give me a false answer. So I said, "You just explain me your profession." He said, "Well, he's a marketing in charge and he's continuously on meetings, and every other day he would have an alcoholic bout because," he says, "taking the customer to a party place, having alcohol exchange and a dinner is part of his profession." And his owner says that, "Well, you are getting customers to us and all that is sponsored by the company." So he's literally drinking as his professional job, which is so sad. And over a period of time, he's now suffering from hyperpituitarism for all that alcohol thing. I said, "This is one thing you need to stop. We will have to halt this. Because at no point me pumping in medicines to you and going ahead with things." And when I sat down and explained him and wife, both appeared very convinced. And he said, "I never knew that my alcohol could be, I just knew it could be a bad habit, but I never thought it can decline my potential to have a baby." And then he applied back saying that, "I won't be able to take such responsibilities and, having such meetings, etc." And they got the thing sorted out. So look in, if you're even drinking occasionally, and if your occasion is every 48 hours, look into your alcohol and the outcome of your semen analysis and the hormones. And if you're facing hypogonadism, so low FSH, low testosterone with your alcohol, probably that definitely needs to change. Obviously, there would be many couples who will tell me, "Well, I drink very often, my sperm count is normal." I'm not saying it happens to everyone, but who is susceptible to the toxicity of alcohol can only be known after consumption of it. So it's better be careful. Thank you.